I'm Cheryl. I'm from Plainfield, Illinois. I'm a physical education teacher. I came to the Smart Institute for shoulder elbow pain about a year ago. I noticed doing weightlifting, bicep curls, tricep extensions, planks, the muscle was cramping up. And as I continued doing that, it kept getting worse. So I stopped. I went to physical therapy. And then again, it was getting better, so I tried it again and was doing different workouts, and it just wasn't getting any better. So went on vacation, and I noticed that when I was out in the ocean, got caught by a wave, and I felt it. It hurt. I told the kids, I'm like, I've got to get out of the water. I got to sit down. And I got back to the chair on the beach, and it was just very painful. Came home from vacation, went right to my regular doctor, and I see the nurse practitioner there, and she sent me here. She said she's heard of it, she's heard good things about it. Go and check it out. It might be better than regular surgery where you have to get cut open and stitches, and I was just like, anything's better than that and being put under. So I came here, met Dr. Honeyus, and he did ultrasound and found that I had 4 tears in my shoulder, 2 in my elbow, or 1 in my elbow, 1 in my tricep. He recommended platelet-rich plasma therapy, and we went from there and got it done. It took about 3-4 months. My arm is great, my shoulder's great, back to lifting weights. Haven't tried the aerial yoga yet, but it's getting better. Gradually working out and lifting heavier weights. I'm very happy with the results. He did tell me it would only take 3 or 4 months. He did explain that most people get 100% recovery and get back to normal activities. He did explain that he's never done 6-7 shots on one person at one time. He walked me through everything, and I've each time with physical therapy, I would do the exercises that they had me do. It was getting better. One day it was a little worse, take a little Tylenol. I called him, he gave me his cell phone number, he could call him and ask him questions. He said as long as the pain went away the next day, it was all good, it was just muscles. It wasn't the tendons, as long as I wasn't feeling pain in the tendons. I'd come in, check with him, he made sure that it wasn't hurting in the tendons, and I'm back to my normal routines as a physical education teacher, demonstrating for the kids again. With no pain, I can actually do push-ups, no cramping in the triceps. And I've had several teachers ask me, because of their injuries, if I would recommend this. I would highly recommend having this done over surgery where you're cut open and have stitches and you can't move your arm. I mean, I was moving it 2 days after the injections. Dr. Honeyus did explain to me that his visits to the office here were covered by my insurance, that the actual shots were not. The system of running my blood through the kit and the machine was not covered. He brought in Jennifer to talk to me about the finances, because I did ask, does it all have to be paid up front? And they worked out a payment plan for me. But I would highly recommend this for shoulders, knees. The secretary at school was asking about her hips. I gave her his card, and she's supposed to call. The biggest thing is the shots not being covered, and I'm like, well, they'll work with the finances with you and get it figured out where it can be covered.
Cheryl came to see us after she was already being evaluated for her elbow and shoulder that she was having a lot of pain with. And it wasn't just pain, it was interfering with her activities, just normal daily activities, as well as causing some difficulty with her job. And so her primary doctor had already done the evaluation, which consisted of an MRI of both the elbow and the shoulder. Quite a bit of injury patterns seen to both areas. She had at the elbow some of the tendons in that region, as well as the triceps tendon that had a lot of inflammation, and the same for the shoulder, where she had both the rotator cuff as well as her AC joint with some arthritic type change, as well as the biceps tendon. And all those areas that had some damage, and as a result of that, there's chronic inflammation, which is causing constant pain for her, which is exacerbated by certain movements. And as I mentioned, with her job, when she was doing things strenuous, it was causing her not to be able to function as though she needed to be at her career. So came to evaluate. She was sent over to us. We did that evaluation. For her, the decision was that PRP, platelet-rich plasma, was an appropriate treatment modality for her from a regenerative medicine standpoint. And we talked about that at that point in time because she was already failing on all other conservative measures. If it was an acute injury, we of course would have evaluated and worked with that in terms of other non-interventional conservative measures, which may have allowed for healing to occur in that fashion. But unfortunately for her, that was not successful, and so that's why she ended up coming here for further treatment options. And so we talked that through thoroughly with her, and she decided to proceed. It was PRP that we used in multiple areas, both in the elbow, as I mentioned, a couple tendons there, or a ligament and a tendon, as well as the triceps tendon as well. And then the rotator cuffs, the biceps tendon, and the AC joint as well too. So she had multiple areas that we treated at the same time. And she has done great since that point in time. With regenerative medicine, regardless of the option you use, there is still time for healing to occur. But over the course of the subsequent weeks to months, she showed gradual, steady improvement. And eventually she was back to full function in terms of range of motion, no interference with her daily activities from a pain standpoint, is able to return back to work without any limitations, and there's no difficulty with her performing her job, in her job status. So it was a very successful treatment for her, and was able to be accomplished in a non-surgical manner and in a situation where all other non-surgical treatments had failed. Cheryl was great. She did everything that was asked and requested of her. She followed up timely and as needed with us. And that contributes a great deal in part to her success following treatment as well. We need to have that close follow-up so that we can be sure that she is progressing appropriately as we expect, and also to help guide her in terms of next level of activities and when to begin to increase those type of activities to return back to normal daily life, and as well as exercise and activity.